Sallu ala al-Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa sallam. Dear viewers of social media, welcome back again from our Leicester Fazan Medina page, Facebook page. First of all, Jumu'ah Mubarak. And Jumu'ah is a special day, alhamdulillah. There are countless blessings of this day. And also there are many benefits of reciting Durood Sharif upon the Holy Prophet sallallahu ta'ala sallam on this special day. It is narrated that whoever recites Durood Pak 200 times on the day of Friday, Allah Azza wa Jal forgives 200 years of his sins. So make an intention, at least inshallah, try to recite Durood Pak every Friday 200 times or 313 times. The more the merrier. And Alhamdulillah Azza wa Jal, in the Madani environment of Dawat Islami, we keep hearing these slogans, the Sallu ala al-Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa alihi wa sallam. So keep watching Madani channel, and inshallah Azza wa Jal, you will develop the habit of reading the Durood Pak on the Prophet sallallahu ta'ala sallam. Now, in our live Facebook daily live special, Health is Wealth, today our topic is going to be dementia. Inshallah Azza wa Jal, we will show the topic very soon as well. We have got slightly difference today. I am usually your host and I speak to the guest doctors, but today inshallah Azza wa Jal, Dr. Imran will be our host and he will be asking me the questions. The topic is dementia, and alhamdulillah, my experience has been in the old age psychiatry, where I help people with dementia, diagnose, treat, and so forth. So that's just the only reason. And inshallah Azza wa Jal, I would like to hand over to Dr. Imran, and you can ask your questions. Dr. Imran can ask questions to me about dementia. Now, clearly, it is a very important topic. Many of us have got elderly people in our homes. Once you're over the age of 65, then there are increased chances of developing dementia. So, Dr. Imran, over to you.
Yeah, assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
I will be asking you a few questions. As I know, you have got a lot of experience in psychiatry and old age patients, old age psychiatry patients. And this dementia is one of the topics which is a leading cause problem in the community and in our settings. And as you have dealt with these patients before, can I ask a few questions? What do you mean by dementia, and what are these dementia patients?
Well, basically, dementia, many of us would have heard it, and people generally associate dementia with memory difficulties and memory problems. In fact, dementia is a syndrome. It is an umbrella term, which although includes memory problems, but it also, dementia presents in behavior problems. It can affect our mood. It affects our sleeping patterns. It affects our eating patterns. It increases number of different risks. Our activities of daily living are affected significantly. So there is a number of symptoms or signs that are there that are all part of dementia. So dementia is an umbrella term, and it encompasses with it, in addition to memory problems, lots of other issues that affect a patient who is experiencing dementia. जी इमरान भाई.
Memory problems, they have as well, intelligence. Would you explain this one?
Unfortunately, I think we're having technical problems. I couldn't hear you, Imran bhai. Repeat your question.
Yeah, I just wonder that with the memories, there's some intelligence issues as well, and probably activity living in dementia patients as well. So what will be the symptoms of these patients which are coming to us with dementia?
Okay, so basically when it comes to symptoms, we have to be very careful. Clearly, the patient themselves, they will not notice that they have memory problems. They may be aware that something is wrong, but they don't know exactly what is wrong, and they themselves will try unintentionally, they will try to hide their problem. They will know that there is some problem, but they will try to hide it to the best of their ability because they are confused, they don't know what is happening. It is the carers, the individuals who are obviously in touch, in contact with them, who see them, family members, children, friends, and other sort of carers, if they are in a sort of a care home and setting and so forth. They will notice that there is a change in this individual. This change could be in terms of their personality, but most commonly it tends to be around the memory. And especially we are talking about what we call as a short-term memory. Short-term memory refers to the memory that we need to perform our daily actions right here, right now. So for example, let me give you an example. I may know very well about my past 20 years ago, 30 years ago, 40 years ago, 50 years ago. And people may think, okay, I mean, because he knows about his past so well, it couldn't be memory problems. However, if you notice the same individual who may have early symptoms of dementia, how does short-term memory problem presented? Is ask them to make a cup of tea and observe them. How do they make a cup of tea? Now, to make a cup of tea, it's actually a test that our occupational therapists use it as part of assessment as well. And it requires a number of different steps, which is, first of all, filling the kettle, then switching the button on. Once the kettle's boiled, then you get the cup, you put the tea in it, you add sugar, then you put the water, then you obviously put the milk in, and then stir it, and then you obviously drink the tea sitting at the table. Now, if you carefully follow these steps, all of these steps require your short-term memory. An individual who is experiencing dementia, they will struggle with 1, 2, or 3 of these steps. For example, they may put the water in the kettle, but forget to switch it on and do something else. Or they're in the middle of making the tea, they forget completely about the tea, they go and do something else. Or they made the tea, but they don't know that what do they need to do next. They may sort of go and do something else. That's one example in terms of activities of daily living. You may also notice that these individuals, these patients who are experiencing similar problems, and basically what would happen is they will struggle with their activities of daily living. For example, they may forget to brush their teeth, they may forget to change their clothes, they may forget to obviously, what commonly happens is that they forget to take their medication. You may notice that if their tablets are not being used. You may also notice that if they use the medication box, then the medication's not being taken from this. They also forget their appointments. So if they've got a GP appointment or a dentist appointment or any other sort of appointments to do with the banks or other issues, they will forget these appointments because these require our short-term memory. They will also sometimes, they go out of the house, they need to, for example, let's say go to the supermarket, they may forget their way because again, driving to another point requires our short-term memory. That's one thing. The other common things that they may present with in terms of symptoms is that when they are going out of the house, they may forget to lock the key. They may forget to lock the door. They may forget the keys where they've placed them. They may forget where they put their glasses. And this happens. Okay, it may happen once or twice. Many of us may experience some of these symptoms, but it doesn't happen on daily basis. It doesn't affect us significantly in any other way. So what happens is that with elderly patient who is experiencing dementia symptoms, these problems begin to affect them on daily basis. They may switch the oven on or gas cooker on. They may forget it. They burn their food if they're cooking it. They may forget to add the ingredients. These are the short-term memory problems. If you notice any of these symptoms in your loved ones, carer ones, and they are happening frequently and they're beginning to affect them, then that is early sign, early indicator that you cannot miss, you cannot afford to miss it, you cannot assign it to old age problem. This is possibly dementia. Yes, there may be other causes like depression that can actually lead to these problems. Sometimes anemia can lead to these problems. Sometimes thyroid difficulties problems, they can cause memory issues. But what is important is that as a carer, I am not the person who's going to make the diagnosis. So at the earliest opportunity, when you experience these symptoms, then we need to go and see the GP and take the patient. They themselves may be very reluctant to go to the GP. Don't rely on them to book the appointment. You book the appointment. You call the GP practice and say that I'm worried about the memory of my father or my mother or my elderly brother or sister and so forth. And you take them with you to the GP. The GP will then obviously ask them the questions and then take the matters from there onwards. Dr. Imran, I think I may have accidentally, you may have been out of the conversation. So that was, I talked about the symptoms of dementia. Now, clearly, it is very difficult to sum up every single thing in these obviously sessions. So very briefly, I've mentioned these activities of daily living and the problems. So mainly memory problems in terms of short-term memory difficulty, they will show in our activities of daily living, making a cup of tea, brushing our teeth, appointments, medication, driving wise, MOT may be forgetting, road tax is not renewed. We may sort of like begin to have difficulties finding our way, and especially new places. So if they go to a new place, these will struggle significantly because a new place requires a new short-term memory. Where they go frequently, that may not be an issue. Dr. Imran, if you are still with us.
So they have got quite enough problem with the driving.
Now, unfortunately, I can't hear you.
Can you hear me?
Okay, for some reason, I'm unable to hear Dr. Imran. So what I will do is I'll carry on. So basically, if you experience any of these symptoms, then what it is that it's possible that your loved one is experiencing dementia. So you book an appointment with the GP, you go and see the GP, and the GP will perform some tests, and these memory tests. They're very simple and basic ones, and the GP will then refer the patient to a specialist, and usually this is the old age psychiatry specialist, or sometimes known as memory clinic. So a referral will be sent to the memory clinic, but again, it is extremely important as a carer, as a child of this elderly patient, that I tell the GP that if they can send the correspondence to me as well. Obviously, the patient has to sign it from the data protection point of view, but the letters get the copies to yourself as well. Because what happens is that you will also notice, as part of the short-term memory difficulty, is that anyone suffering with dementia, they will fail to open their post. Their letters will be lying there for weeks and so on and so forth. So sometimes they are missing these notices. Or if they do open the letter, they don't know what to do. They obviously can't actually understand that what is that needs doing, because they have a problem with processing of the memory as well. So get the correspondence to yourself, and when you got the appointment with the basically the memory clinic or the psychiatrist, then make sure that you take your mom or your dad or your elderly brother or sister or uncle or aunt with you. Drive them to the hospital, be with them. And it's for two reasons. One is that it's made sure that the appointment's not missed, because I have seen in clinical practices that sometimes appointments are missed. When the appointments are missed, as you know, in NHS, then the next waiting list may be another 2 months down the line. And time is very crucial in terms of these memory problems. So that's one reason that the appointment's not missed, that no delay is, so we prevent the delay. The second important thing is when you see a doctor or a specialist nurse in the memory clinic who will be performing the interview, they need the account from the other person who is with them. So don't send anyone, even if you are the one who is looking after, you are the one who knows most about your mom or dad, about their memory difficulties. You are at work, please take some time off work. Let your manager know that this is important, that I attend this appointment. So you go and you obviously give the information as much as possible, because the patient themselves, as I said previously, they will be unaware of these deficits in their memory. So they will not be able to give much information. So we always request family members or carers to come and attend the memory clinic with the patient themselves to get most information. And then what happens is, obviously the specialist nurse or the doctor who's seeing the patient, they will complete their assessment. It's usually an hour long, and there is a memory test again, and then they will request investigations, which includes bloods, which usually the GP, they do them themselves, and they send the information to the specialist. And then the specialist, depending upon the history of the patient, there could be a number of different causes for dementia, because dementia itself is not a diagnosis. As I said, it's an umbrella term. So there's an underlying disease process in the brain. So the specialist will then need to do investigation, and usually this investigation is a CT scan, a particular CT scan of the head. And the specialist will also be doing other investigations like an ECG to look at the condition of their heart, that if we need to start the medication in the future, then their heart is in the good condition. So depending upon the CT scan results, usually there are two main types of dementia. There are two main types of dementia. Yes, there are quite a few others as well. But these two main types of dementia, one is Alzheimer's disease, and the other is vascular dementia. There is a third one as well, which is not as much common, but not rare. It's called Lewy body dementia and frontotemporal dementia. So these are the sort of four types of dementia, but the most common ones are Alzheimer's dementia and vascular dementia. Now, the good news is that the Alzheimer's dementia, although none of the types of dementia are curable, unfortunately, they cannot be cured. It's a disease process that progresses, unfortunately. Medicine at the moment does not have a cure for it. However, not having a medication does not mean that we cannot manage the condition. Alzheimer's dementia, there is a particular area of the brain which is called hippocampus. If the brain cells in the hippocampal area, they have been destroyed by the disease process, then it will shrink. So what we call as atrophy. So shrinking of the hippocampal area on the CT scan is confirms the diagnosis of what we call as Alzheimer's dementia. Now, Alzheimer's dementia, we can use medications to actually slow down the process. Slow down the progression of dementia. So overall, if someone were to use the medication for dementia for 1 year, basically, if they were not to use the medication, then they will get worse. In 6 months, they will worsen to a state where with medication, it will take 1 year to reach that worse state. So clearly, the dementia medication, in terms of Alzheimer's dementia, it slows down the progression. What does this mean is that you get more quality time with the patient. You get more quality time, their behavior is much more manageable, and you get less problems. Okay, so let's say that your loved one, you identify that they were having these problems, you took them to the GP, you took them to the doctor specialist, The investigation was done, the diagnosis was made, whether it was Alzheimer's dementia, vascular dementia, Lewy body dementia, frontotemporal dementia. If there was a medication needed, then the doctor will start the medication. Then what happens next? Now, this is where it is extremely important. I'll try to add Dr. Imran if but I do start getting background noises. Ji, Dr. Imran, are you with us?
The bike.
Ji,
Too much disruption or
unfortunately, for
I
some
heard about
reason,
your investigation.
Ji, carry on.
You heard about your investigations and all those. You mentioned all the investigations. So, as you said, all of those, would you what you would consider the tolerance and the patience of the family members in these patients?
Tolerance in what sense?
The tolerance and the patience the family members have to
Okay.
do while supporting their dementia patients.
Okay, right. Now, clearly, this is an important question, because what happens is that the dementia is a very debilitating condition, unfortunately, because the brain cells are dying. So what is happening is that from our behavior point of view, what we say is that our behavior is going to regress. The sleep pattern is affected, the eating habits are affected. Sometimes patients don't eat, sometimes they forget that they've eaten, they may be asking the same question time and time again. Have I done this? When is my disappointment? And so on and so forth. And clearly it requires a lot of patience and tolerance from the family members to understand the where they are coming from. So clearly, if my elderly parent is asking me a question 10 times, the same question time and time again, it is going to be quite stressful. So I need to understand that they've forgotten, they've got memory problems, they've got memory difficulties. So I need to hold my patience, and it's a big test. And not just that, but also the behavioral difficulties. There are a number of different risks involved in this, which we'll come to talk about that as well. So family members, they need to be patient, they need to be persuading, and they need to be looking after these individuals. Because if I lose my patient and I get angry or upset or shout at them, then this is adversely going to affect their mental state. They will get sad, they will get stressful. And clearly, someone who gets stressful and they've got memory difficulties, this causes much more problems for them in terms of behavior difficulties. Ji, Dr. Imran, any other question?
The heard about your the tolerance and the patience of the family members in support of these dementia patients, and what will be the risks of these patients when they are at home? Like they will be falling over, and the patients, as you mentioned, the patients are forgetting things.
Okay. Risks in terms of people who got memory difficulties or dementia, depending upon at the early stages of the disease, there may not be that many obvious risks in terms of risk to their own safety and the safety of others, if we look at from that point of view. However, as the disease progresses and the memory problems begin to get worse, then these dementia patients, they can be risk to themselves in a number of different ways, and they can be risk to others in a number of different ways. First and foremost is driving. If they are still driving, then DVLA will be informed. Mostly we request the patients themselves or their family members to inform the DVLA. But if they are not in such a state, then the doctor themselves inform the DVLA. The DVLA then send a report to the treating clinician and asking them, are they safe to be driving? Now, based on the doctor's assessment and so forth, they may make a recommendation, which may mean either they carry on with the driving or they need to have a test of their driving. So driving is the first and foremost, and from the family members' point of view, they sit with them as a passenger and go on a drive. If the carer and the family member thinks that they are a safe driver, their mother or father or uncle or aunt, and they feel safe and they can have their children in the car with them, then that's okay. But if you have any concerns, then please inform the doctor, the GP or the specialist doctor. So driving is the first and foremost. Then it comes to obviously in the house. What happens is, as the memory problems get worse, these people will not know what is the function of certain things. So for example, there are countless examples. The important thing is gas cookers. If you have gas cooker, then they may leave them on after they have cooked, or even worse, that they may switch it on but do not ignite it. Okay, well, these days what happens is, although there are automatic ignitions, but sometimes ignition does fail. So I may have to try it again. But someone who is demented, suffering from dementia, then they may forget about it. So the gas may be running, and what happens is you need a spark, and it can lead to explosion. That's a significant risk that we have to. So generally, you would have noted that city council in accommodations, they are now putting in, rather than the gas appliances, electrical appliances. So replacing a gas appliance with electrical appliance can actually mean that they can maintain their independence. Then also the risks in the kitchen, the knives, they may not be aware that what is the function of a knife. They might want to cut something else and end up cutting themselves. So knives are risks. Falls can be a risk, because what happens is that these individuals, they wake up at night, sometimes they don't sleep, or they are up at night and wandering. And if, for example, they wake up, they don't have an idea. If me and you were to wake up suddenly from our sleep, we will be a little bit confused for a short time, thinking, where am I? And then within few seconds, it comes to me, yes, I'm at home, it's nighttime, this is where I need to go. But these patients with dementia, they may not be able to make this assessment. So they may actually not remember where the stairs are, and they're going there and they have a fall. Or most importantly, that they may get out of the house not knowing where they are, where they're going to go. So elderly people, they can actually get one of the risk is wandering out of the house. The other thing is, sometimes those elderly, especially who are living on their own, they can actually be victim of fraud. I have dealt with quite a few patients where these telecommunication companies, they give you cold calls. And when these dementia patients receive these cold calls, and this individual from the front is selling a product, genuinely, what happens is that these dementia patients, they don't know that what is this person selling, but they may agree to the sale even when they don't need it, and they will even give their credit card details. So genuinely what happens is that these individuals end up buying products worth hundreds of pounds, thousands of pounds, which they don't need. And it is the family members, they then get involved. So there are financial risks, there are risks in terms of falls, there are risks in terms of wandering, there are also risks in terms of kitchen fires, and so on and so forth. Sometimes they may actually leave water taps running. Okay, now that could flood the house. And very importantly, if there is a bathtub that they fill and then sit in to have a bath, someone who is suffering from dementia, this is a major risk, and they could actually even lead to drowning. Okay, so we usually recommend that these patients do not have a bath. They tend to have a shower, so some house adjustments are needed. These are some of the risks that are mentioned. There is still a long list of these risks that I could go on, but our time is nearing enough as well. Dr. Imran, I think he's left us. My apologies for having these technical hiccups. We are struggling with this software that we use, although there are benefits of this, but there are also some side effects. But anyway, today we tried to have a discussion about dementia. By no means it is complete. Okay, but what my final summary advice to viewers of my our social media page is that if you suspect that your loved ones may have memory difficulties, please go to the GP, take it on yourself. The GP will help you get the diagnosis and treatment if possible. But in addition, what is now more important is your role as a carer, because these people are now going to require, they will be dependent upon you. Now, you may be working, your wife may be working, you may not have time, but it is extremely important that somehow we manage the caring role. This is where you will have a carer's assessment. The GP will organize this. The social worker will be involved in doing a carer's assessment. And this carer's assessment is extremely important. It will educate you. It will help you looking after your loved ones much better way. And it will look at the potential additional support that you will need in terms of looking after your loved ones who are suffering from dementia. And then as the dementia progresses, unfortunately, the behavior of the patient does get worse. So they will need additional medication. Sometimes for anxiety and agitation, they may need medication. Sometimes these patients, they begin to experience what we call as psychotic symptoms. They may get hallucinations, especially if it is Lewy body dementia. These hallucinations can be very troublesome. So they will need what we call as antipsychotic medication. So there is a lot of scope from a medical point of view, but also very important is your role as a carer. So you will need a lot of help from professionals, your GP, your social worker, your psychiatrist, and also the carer agency if there is a need for it. Then obviously, so I have come to an end of this silsila. There's a lot more that could have been said, but inshallah we will try to cover this topic another time. Very important topic. I hope you enjoyed it. Apologies for a bit of a technical hiccup today. Inshallah will be I'll be back again tomorrow with our Madrasatul Madina lead Abdul Hafiz Bhai, and we'll be talking about services of Dawat Islami from a Madrasatul Madina point of view. And inshallah, on Sunday, I'll be back again with Health is Wealth, and we will be talking about reflux disease, gastroesophageal reflux, heartburn. So that's another important topic, and especially during the month of Ramadan, we eat plenty of things and it causes heartburn. One of the symptoms is burping. So we'll be talking about heartburn. And inshallah, for the next week, we'll carry on with our daily Facebook Live. Keep watching Madani channel and please do join us. And Dr. Imran, thank you very much for your presence. Unfortunately, with technical hiccups, it couldn't work out the way we wanted to. But Jazakallah khair for your session the day before and today. Assalamu alaikum wa rahmatullahi wa barakatuhu.
Wa alaikum assalam wa rahmatullahi wa barakatuh.